We use that
That's
terminology a lot
awesome.
in Medvantx right now of you have to be comfortable with being, or I should say comfortable with being uncomfortable, because there's always going to be something new. There's always going to be a challenge. But if you're the type of person that is up for that challenge and is up for a little bit of that chaos, I think that you
Yeah.
find a lot of opportunities will come your way, good and bad. Sometimes people wind up dumping things on you just because you're that kind of person that says, yes, I'm willing to take on the challenge. But when you kind of come out of it, you start to realize, okay, I thought this was daunting at first. However, I was able to troubleshoot. I was able to figure it out.
Yeah.
And now I can utilize
awesome.
that in the next task, in the next project.
Yeah. I love the lifelong learner frame, which is actually one of the reasons why the podcast is called The Business of Learning, because one of the things that frustrates me the most is people who finish high school or college and then that's it. That's their learning for their entire lives. Hello, everyone, and welcome to the Business of Learning podcast. My name is Joao Camargo. I am your host, and my guest today is Paige Carbon, who is the Director of Business Development and Sales Ops at Medvantx. Paige, thank you so much for being here today.
Thanks for having me here, Joao.
I'm excited to have this conversation. Why don't we start off with you telling everyone a little bit more about yourself, a little bit of your background, which I know is very extensive, so we don't have to be here for many, many hours, but also a little bit more about Medvantx, who you guys are and who you help.
Yeah. So my background is in healthcare. I've been in healthcare for a little over 10 years now. Actually started in the lab as an oncology researcher. Was very excited about science and always interested in STEM. But then I transitioned into more business and more business relations. So after I left my oncology research position, I went to work for a couple different companies, some big pharma, did a stint of consulting. But now I currently sit at Medvantx, and Medvantx is a independent, non-commercial dispensing pharmacy. And what that means is we operate a little differently than your CVS or your Walgreens, for example. And the way in which we work is primarily most of my clients are pharmaceutical manufacturers, and a bulk of our business is in what we call the free goods or patient assistant programs, depending on what keywords you'd like to use. But what I love about my job is helping patients that need access to care. So patients that would be not able to afford their medication because they're either underinsured or not insured at all, are able to receive, based on certain eligibility criteria, their medications for free through our pharma partners. So it definitely makes my work really exciting when I know that I'm touching lives that, really essentially need these medications.
Awesome. And so just for a final clarification there, so the model is really partnering with these organizations, these companies, so that their patients, the people that they facilitate these medications for, can have that end results that really has that valuable impact in their lives. Is that correct?
Exactly. You got it perfectly.
That's awesome. And talk to me a little bit more about kind of your, as I said, I don't want to go into the entire journey because I know we'll be here for some hours, but how did you end up in Medvantx, and also a little bit more on if you're able to, of course, elaborate on the origin story of the company. Why did it even come to be in the first place as well?
No, those are great questions. Yeah, my journey is definitely very varied, but I think that's the fun part about my experience. I'm someone who takes opportunities that have come to me, and I've been very fortunate with the positions that I've had. Obviously, it stems from experience, having a background in healthcare, understanding the science, understanding the how, and the mechanisms behind it all has really helped me even as I've gone out of the lab, because I understand, the necessity that is the science that's behind everything that we do. When I did my first position outside of the lab, it was global clinical trial management for a big pharma company. And so it was more data analytics, which was very fun because I put on my data hat that I had as a scientist, but also got to do things like work with the regulatory team and help kick off clinical trials. So working with physicians and working with the site managers. So I got to build on some of the skills that I had previously and then learn these skills along the way. But that, I think, has helped me in every position that I've had, because I'm a lifelong learner and I want to continue to grow in the fields that I'm in. So I think it definitely is a combination of my skill set, but also my ability to learn new things and me always saying yes to new opportunities. So yeah, I've kind of just built on every position that I've had and have really learned to put on a hat that's more of like a growth mindset. We use that terminology a lot of Medvantx right now of you have to be uncomfortable with being or I should say comfortable with being uncomfortable,
Mm,
because there's always going to be something new. There's always going to be a challenge. But if you're the type of
yeah,
person that is up for that challenge and is up for a little bit of that chaos, I think that you
yeah,
find a lot of opportunities will come your way, good and bad. Sometimes people wind up
yeah.
dumping things on you just because you're that kind of person that says, yes, I'm willing to take on the challenge. But when you kind of
Hmm.
come out of it, you start to realize, okay, I thought this was daunting at first. However, I was able to troubleshoot, I was able to figure it out.
Yeah,
And now I can utilize that in the next task, in the next
yeah.
project.
I love the lifelong learner frame, which is actually one of the reasons why the podcast is called The Business of Learning. Because one of the things that frustrates me the most is people who finish high school or college and then that's it. That's their learning for their entire lives. No
Yeah.
more, nothing more that they want to to know about or learn about. And that, at least from my point of view, is such a waste. I'm like I'm doing my best to learn something new every day. And I'm like, of course it can be like, oh yeah, I learn something new every day. Like people always say that. But hey, how can I take everything that I go through, the experiences, the challenges, all these things, and take it as a lesson? Or even just from reading other people's from reading autobiographies or books, whatever it might be. But the reason why it's called The Business of Learning, because I think we are all in some type of way um, lifelong learners if we're willing to be that type of person, of course,
Yeah.
which I think is the best path as opposed to the other path. But sorry, I interrupted you. Please keep going on your thought.
Good. It definitely is. And I think that a lot of people would ask me, how did you get to this point? And it's hard to even answer that question today because I feel like, again, it's because of my openness to learning new skills and me always questioning, okay, well, I'm familiar with science, but I want to understand
Yeah.
more about, how do you operate a lab? Or, okay, I'm familiar with operating the lab, but now I want to know more about the business side and what are some of the partnerships and relationships that make things work. And so those are the skills that I've acquired over time because I'm always asking questions. And I've been very fortunate
Yeah.
to also have bosses that have been able to let me learn those different skill sets, even if I
Mm,
don't necessarily have all of the background information, whether
mhm.
it's taking on a new project, whether it's working collaboratively with somebody outside of my department. And I
Mhm.
think that has really helped me too. I think in order for you to grow as an individual, both personally and professionally, you have to be willing to be able to get outside of your comfort zone and
Mhm.
say, even though I don't have all the skills necessarily, or I maybe don't have the education that I need,
Yeah.
what can I do now to help build that skill set? And I think we're going to talk
Mm,
about this probably in a little bit. That also goes into some of the work I do outside of my day to day job, which involves being
mhm.
involved in a lot of different networking organizations.
Yeah.
I think that is so essential for both,
Mhm.
founders, entrepreneurs, or just even in the corporate setting,
Mhm.
is you have to
Yeah.
be willing to join organizations of like minded individuals and learn from them. And it's also important to diversify your network.
Yeah.
I had always been in a lot of healthcare related networking organizations, but then as of late have joined technology organizations and entrepreneur organizations, or even
Yeah.
just I live in Tampa, so Tampa business networking organizations, and I
Mhm.
have learned so much from those individuals that I wouldn't have been able to interact with had I not stepped outside my door and decided to just join
Yeah.
happy hour or a networking.
The willingness to do it.
Yeah.
Yeah, 100%. That's awesome. And yeah, that kind of leads perfectly into what I wanted to ask as well is as you were kind of doing that transition from being a scientist and really hopping into, I guess, more of a business hat, a business owner type of hat, right? That entrepreneurship hat is how important was it? Actually, not how important because clearly it's very important to do the thing that I will ask you. But how did you approach? What were some of the things that you found were the most important to acquire those new skills? So, of course, you're a director in business development now, sales operations. There's many skills that have to be taken and learned to be able to step into that position and help the business that you're working with grow. So, what were some of the things that you found the most impactful to be able to learn those skills, be it internally within the organization or doing it externally with the networking that you've done as well?
Yeah. So to take that on, I think for me, it was joining very early on, joining as many meetings as I could that I was allowed to join.
Mhm.
Again, when you're new to an organization and, there's always going to be a little bit of a gap in some sort of skill set that you're looking for. I took those first 90 days to really understand the job, understand the role they were asking me to do, and understand the business. And so I jumped in really head first and was like, how many meetings can I join? Can I fill up my calendar? And again,
Yeah.
outside of even my department, because you're right, in sales, we wear many hats, and you are working, interdisciplinary with other departments. And so I would want to
Yeah.
join, the IT meetings, and I would want to join the clinical meetings,
Mm,
and I would want to join the regulatory meetings, and just learn from all the departments to understand the business so that I could be able to interact with the client in that way and share with them what the business was doing.
mm,
So that I think is really important. Again, always learning and trying to stay within my field, but also understand, what's really happening behind the scenes so I can better
mm.
understand the model that I'm trying to,
Yeah.
convey to the client. Um,
Uh-huh.
and then to your point, personally, it's just listening to different books, audiobooks on business
Mm.
skill sets. There's so many things out there now, so much content that you could listen
Yeah.
to
Yeah.
without
Is
even
there any book
needing
that
your
stands
own
out to you that
VA. Yeah.
is there any book that really jumps out at you? Like, oh, this one really kind of
Oh,
impacted
man.
me?
I'd have to think back because it's been probably like a year or 2 since I've listened to some books. I've joined more
Okay.
panel sessions as of late.
Hmm.
So, like, I've kind of pivoted from more audiobooks to doing things more in person. So I join a lot
Mm.
of panels and informational sessions, whether it's technology in business, if it's healthcare in
Yeah.
business, if it's what's happening just in the business sector, within my field.
Hmm.
Going to, working at Medvantx where it's more patient access centric, going to
Hmm.
conferences that are focused around patients, going to conferences where patients are actually attending. You interact with patients and understand
Hmm.
their needs and their troubles and what they're dealing
Yeah.
with and how we can better serve them.
Hmm.
And also, again, those are where the panel sessions or the online webinars. There's a lot of great organizations that put on content that are relative to what I
Yeah.
do today. So it's just
Hmm.
always finding time to find a way, whether it's an hour to a week, even if it's just 2 or 3 hours worth of content, but just always trying to
Yeah.
stay up to date on what's happening out there.
Yeah, no, that's awesome, and I love to hear that because in a way it all cycles back to wanting to learn or having the willingness, but not only the willingness, actually taking the actions to achieve these things. I think it's one of the things that separates very successful people from people who only achieve the how do I frame this? Who achieve enough
Yeah.
to be like, yeah, this is enough, but they don't want to go beyond, or they want to go beyond, but they don't have the capability to actually walk the path.
Yeah.
And people that take action are willing to learn, but not only just again, like I said, repeating myself here, but not only willing, actually taking the actions is one of the most important things. So that I really really love that frame. And through so many conversations that I've had, Paige, uh, especially when it comes to the B2B sector, companies that are that have that working dynamic, a pattern that I've noticed is that one of the challenges in creating a lot of these new relationships is trust.
Hmm.
And I think, of course, trust is important everywhere, but specifically when it comes to B2B, because they are longer sales cycles, because there's so many things that get piled on to get the deals across the line. So I wonder if for you and Medvantx, that's something that also is a challenge that can be difficult to overcome. And some of the ways that you guys try to handle that obstacle to, of course, keep the company growing as much as possible.
Oh, yeah. I feel like I can go on about this all day long because it's essential for every business, like you said, but
Hmm.
especially when you're B2B, and especially for Medvantx, where we are building multi-year programs, so we want long-term partners. We have several long-term legacy partners. But how we build that trust is first and foremost sticking true to what we do best, which is
Mm.
dispensing medications and making sure that we are providing the highest quality, from the techs that review your order to the order entry process when the prescription is coming in, all the way until
Hmm.
it gets to the patient's, home, and ensuring that they receive the medication. This isn't a Medvantx specific thing, but in the
Yeah.
pharmacy world, we talk about the 5 rights of medicine. It's, that's essential. And so we hold those key values at every department and within every person in the organization, even myself, even though I don't look at the prescriptions and I'm not fulfilling orders. I think it's
Yeah.
essential that our quality and medical affairs team make sure they are performing their job well and ensuring that,
Hmm.
again, at the end of the day, that patient is getting the right medication, the right dose,
Hmm.
the right time, and
Hmm.
all of that. So that's what we do best in terms of ensuring
Mm.
trust. It's sticking to the business. We're always going to have
Mm.
clients that are going to ask us to do new things, and we're going to always
Yeah.
pivot. And it's a great part of our job is actually being collaborative with our
Hmm.
partners, which is really fun, and it's helped us grow as an organization. But we
Yeah.
still have to stick true to what we do. And so our
Yeah.
pharmacists take their job very seriously, and they do a phenomenal job of keeping up with all the state and federal regulations, all the things that are constantly happening that to keep track of. But
Yeah.
we always ensure that we are holding to ourselves first and foremost so that the patients receive what they need.
Yeah, that's awesome. Like that transparency within the relationship. Like, hey, this is amazing. I'd love to have that conversation. More than happy to like, take on the idea, see if there's something
Yeah.
that we do. But if it's outside of our scope, then it's outside of the scope. We focus on what we actually good at. That's awesome.
Yeah.
And how about conveying that trust to? So on the that's the one side of the coin is like, of course, the companies you guys are working with. How about conveying that trust to new companies that you guys are trying to reach out to get those opportunities? Because I think once you start to work with someone, then the results come through, they see how great you are, then that path gets like really clear, all the weeds get out of the way, and boom, just walk through.
Yeah.
How about before that, trying to convince or show someone the value that you guys would be able to bring to them?
Oh, yes, that is a constant, especially me sitting on the sales team, is making sure that we're conveying that message. I will say, pharma is quite small. It seems like there are, many, many companies out there, but in terms of
Mhm.
the individuals, it's really quite small, and word of mouth is still one of the best sales strategies that we have. So we have a lot of
Mhm.
clients that just know about us from other organizations or know about us maybe from conferences, for example. So that's one way that we build our sort of credibility and people knowing who
Yeah.
we are is putting ourselves out there. In
Mhm.
terms of when I'm interacting with a brand new client that maybe hasn't heard of Medvantx before, what I really convey is that quality side. So it's talking about the
Mhm.
pharmacy and the pharmacist and what we do day
Mhm.
in and day out and how we do it well. Because I think
Mhm.
you can, share shiny little blurbs about, the latest technology, and you can talk
Yeah.
about how special this one thing that we do is for this one client. But I think what comes through every single time, what has resonated with a lot of the clients I interact with, is what we do in the pharmacy and how we differentiate ourselves compared to other
Mhm.
independent pharmacies.
Mhm.
So again, we're not trying to be like everybody else. We really are
Yeah.
trying to what we call, best class in the pharmacy space, and
Yeah.
bring services that are of value to both our clients and to our patients. And so we're always
Mhm.
steering between the two. It's ensuring the patients get what they need and making sure that we're
Mhm.
up to date on all the things that are happening on that side. But it also is talking with our clients to say, we haven't thought of this before. Thank you for bringing this to our attention. How do we
Mhm.
work together and bring this idea to fruition that are going to help your patients? Because all of these programs we work on are very unique and independent of each
Yeah.
other. And that makes
Mhm.
my job also really special because it's fun to collaborate with clients in that way.
No, that's awesome. And you, your answer there just reminded me of a quote that I love, which is do what everybody else does and get what everybody else gets. So by copying everybody or trying to be like the others or doing all these things, then you're just gonna get the same results. But stepping away from the path and really differentiating yourselves, of course, through the value that is brought, but in the messaging and how you portray yourselves to people, I think is so important. But it's so common. I don't know if you agree with this. I find that now, especially with social media, like we're old or something, but especially with social media now, people tend to model other people that they strive to be towards, and it just becomes like everybody's kind of saying the same things. It's like, okay, yeah, just keep doing what they do, you're gonna get what they get. But if you want to get your own results, you do your own thing, be you're on your own path, then you have to do your own things as well,
Oh,
which is
yes. And at Medvantx, our CEO is all about this. Again, like you said, you could try to copy other people. It's not going to serve you at the end of the day. And
yeah.
from Medvantx, they've been around for quite some time, so a little over 20 years. The
Mhm.
company has, pivoted and done a couple of different programs, but really the free goods, the patient assistance side has been the bulk of the business for over 15 years. And then we
Mhm.
have pivoted to what we call DTC or direct to consumer, direct to patient like models,
Mhm.
because unfortunately there are some medications that won't get insurance coverage. And
Mhm.
so the workaround for some products is that you offer it at the retail cost of the medication to the
Yeah.
patient, and then they still receive it directly at their door. So it's giving the patient options. It's understanding that while some programs aren't specific to the free goods space, we can still serve our clients in other ways. And so that's where
Mhm.
Medvantx has really been innovative over the past 10
Yeah.
years, is finding new ways to still serve patients and serve our
Mm.
clients, and to support them. Because again, we have the pharmacy, we have two locations actually. So how can we
Okay.
use what we have and use our pharmacists and our experts in this space to then serve, other manufacturers that maybe we weren't
Mhm.
touching previously the decade before. And to your
Yeah.
point, it's,
Mm.
while there are a lot of competitors in this space, we're not trying to be like them. We really are
Yeah.
seeing out in a way that is different. I think that also resonates with a lot of our, pharma clients because they
Hmm.
understand they can come to us for very specific things and then maybe go
Yeah.
to others for other services that we don't offer. But we're not trying to
Hmm.
chase every single opportunity out there. Again, we're
Yeah.
trying to stick to our core values,
Yeah.
which is being innovative, being collaborative, being ethical, and working with what we have.
Yeah, and that's awesome. And it's also one of the situation which, if you are copying someone, by definition, you are second place. There's nothing that you can do about that. And people can copy the marketing, the
Mhm.
strategy, whatever it might be, but they can't copy the proof. They can't copy the results. They can't copy the value. So
Correct.
they're going to be trying to follow through on all these things, but when the actual execution comes through, it just falls down. Um,
Yeah.
and it has no structure, it has no foundation. So I think it's always one of those things that when speaking about modeling and the copying or whatever people try to do to excel, it only gets to a certain point, and yeah, it doesn't help the person that is trying to do
It
the
does not.
copying or whatever that might be.
Not.
Awesome.
And that could be difficult for a lot of people to understand, especially if you're a new business or you're kind of getting into the space for the first time. You want to see what
Yeah.
everyone else is doing, which is great for benchmarking. It's great to
Yeah.
benchmark and look at what other companies are doing, but then you really have to understand again, what does your business do really well? And what can
Hmm.
you then try to hone in on that is different from everybody else? And
Yeah.
not only figure that out, but also then understand, okay, where is my market then? Because there
Mm.
might be that small little niche, market that is really your core
Yeah.
value and where most of your, clients want you
Mm.
to be at. And when you start to pivot from that, you're going to lose your core clients. You might gain some new ones, but you're
Yeah.
going to lose the core clients that actually would help build your business. And so for
Yeah. Long term.
from my experience, over the past
Hmm.
couple of 2.5 years working here, what I think Medvantx does really, really well is ensuring that we don't stray too far from what we do well.
Mm.
Because so many people will come to us that aren't necessarily pharma partners or they're, doing something else in the business, which is all very interesting. And sure, we
Yeah.
can still be a fulfillment partner for you. However, if it's going to stray away from the operations that we do day in and day out, is it really
Yeah.
going to serve us at the end of the day? It's going to take away from what we're
Yeah.
doing now, and it's going to essentially be noise. And
Yeah.
we don't necessarily need the noise. We want to continue to build and grow with the partners that we have.
Yeah, and that makes so much sense because in the long term, it doesn't fulfill what the business actually stands for, right?
Yeah.
So, yeah, sure, you can get the small wins in the beginning, but they'll turn into huge losses on the long run. So it's like, not worth it, not
No,
worth it.
not worth
Yeah,
it.
I have a couple final questions here for you,
Yeah.
Paige. One is a question that I've asked in some different ways, but pretty much for every single guest that has come on. And I'm sure you watched Riley's episode as well, so you'll be getting the same question that I asked him, which is, if you just had this magic wand and you could wave this amazing phenomenal wand to solve one problem, one challenge, one obstacle in the company that would allow you to reach all your client acquisition, your revenue goals, whatever they might be. Oftentimes we have so many priorities, so many things that we are trying to overcome, but you just get one for this. What's the one thing that you'd like to solve to be able to get as many clients as you want, bring as much revenue as you want?
Oh man, yes, that would be wonderful, right? I wish I did have a magic wand for every single thing, personally and professionally. Um, no, I would have to say the magic wand would just be, I don't even know how to describe them. I have to put it into like a certain word. I'm trying not to be long-winded with my answer, but if
Okay.
I had a magic wand for my role and what I do within the company, um, it would honestly just be, I wish I had more time in the day. Right?
Mm,
I wish, we are a small but mighty organization. We're a little over 250 employees. The majority of those are the pharmacists and the farm techs. I sit more on the, corporate executive side. And I will say
mhm,
personally for me, if I had more time to just spend more time with clients. I
mm,
love the interactions that I have with my clients, and I love that I get the time to meet with them, whether it's in person or it's, in conversations like this, whether it's, virtual. But I'm one person, right? And on
mm,
our team, we're very small and lean and mighty. But if I had more time in the day to interact with more people,
mm,
that'd probably be my magic wand. Because
interesting.
I'm one person. I do only have certain
Yeah.
hours in a day. I feel like I
Mm.
could get more done if maybe there were more of me. Maybe I should clone myself, and that would help.
I actually, there was a question that was like, if you could clone yourself, what would you do? But that was like,
I think my
wow,
boss has asked me to clone myself. She wishes the same. I think she would want me to pick too, and that would be my use for my magic wand.
That's funny and interesting. What would you do if you had more extra time? Because what I'm trying to understand here is, I think, and I'm not saying this is of you. Please do not take it that way. But I think so many of us can get quite busy just being busy. So when you say more time, is that for being able to handle more sales conversations? Is it more for client fulfillment? Is it trying to find more of these relationships to build that trust, to get more revenue for the company? What's the thing that would be like a most priority for you?
Oh, definitely more time to interact with clients. I think especially in a sales role, right? You're so
Existing client.
limited in how much time you have in the day to interact. Always trying to, chase down times and calendars, and that's always a struggle. I know like your company does a great job of utilizing technology to try to leverage that so that salespeople aren't wasting so much time, whether it's in the cold outreach or whether it's in the follow-ups. There's definitely things you could do to help automate or semi-automate the process. And our company utilizes as much of that as we possibly can. But at the end of the day, it's going to be the people like myself who are spending the time with the clients, building that trust and sharing our
Mm,
capabilities. That's going to close deals, right? So the emails don't close
hmm.
the deals. It's the phone calls, it's the meeting in person.
Yeah.
It's really interacting with the client. And so certainly if there's more that I could do on the latter part of that versus the former being, the emails and the trying to coordinate calendars, then I think that would
Yeah.
help free up more time that I could spend with clients.
Mm, interesting. Yeah, that makes more sense. Thank you for the clarity there. And I think so many, as I said, so many people get busy just being busy. So
Yeah.
it's just part of it. And then final question that I have here for you, same dynamic as the episode you watched. I have a final question, which is not from me. It's from our last guest to you, and they had no idea who you were. So are you ready for the question?
Oh boy, I'm excited. I'm ready.
Here it is. How can you keep improving the culture of your company and take it to the next level?
Ooh, I love questions about culture because I feel like Medvantx has done it really right. Listening to all of us that work in Medvantx and ensuring that we have what we need, whether it's training, whether it's getting support from your manager. So, how we can improve the culture. I think that our company has done a really great job in the professional development and investing
Mm,
in the professional development of everyone in the company. So actually last year I was very fortunate to do a program called Labs to Leaders. And it was this great 6 week, I think it was 6 to 8 week opportunity where we came in
mm,
and for a whole Friday, every other Friday, we got together and it was on different aspects of leadership, whether it was team leadership, collaboration, growth mindset. What do you have to do to get around some of the nuances of your company and how you all work together. So different people
yeah.
from different departments actually joined this meeting, and I get to be a part of it. And I really
Mm.
appreciate that Medvantx invests in its people. And so I think that they will continue to do that. And I'm excited to see what opportunities I'll have in the future to grow within the company.
That's awesome, and it's great to hear it. It also reemphasizes something that I was actually um, speaking with a guest yesterday, which is I think part of the amazing thing about the internet nowadays. Again, talking like we're older, like the internet hasn't been around for over 20 years. But is of course the remote side of things. Everybody can work from wherever they want, but there's like that extra sauce that comes from the in-person conversations, having everybody together.
That's true.
And yeah, it's awesome to hear that from your side of things as well. Paige, thank you so much for this conversation. Such an incredible talk. Thank you for your insights, obviously sharing about your story. Where should people go if they want to learn a little bit more about yourself or a little bit more about Medvantx?
Yes, I'm very active on LinkedIn. So certainly you can look for Paige Carbon on LinkedIn. You'll see all my posts there. Medvantx is medvantx.com. So please go on the website and take a look at what we're doing. We're always excited to talk with anyone who's interested in our company and how we support patients today.
Amazing. I will, of course, leave everything down below here if you want to check those out. If you enjoy listening to this conversation and you want to hear more conversations like this, please subscribe and I will see you on the next episode. Thank you so much, Paige.
Thanks.